Welcome to the September Spotlight on Long-Term Care, brought to you by ProducersWeb.com. I'm Sarah Fletcher, and in this broadcast, we'll cover some of this topic's biggest trends and insightful research. This Spotlight on Long-Term Care is sponsored by Personalized Brokerage Services. PBS works for me. For more information, please visit www.pbsworksforme.com. The American Health Care Association says nearly half of polled Americans feel that Medicare cuts to assisted living facilities are an unacceptable way to fund health care reform. In fact, only 3% of respondents think slashing this budget is a good idea. The Millman Group asked the question, if Congress cut $32 billion in Medicare payments to nursing homes to care for seniors, do you think the quality of care would get better, stay the same, or get worse? Findings indicate that 66% of voters would be less likely to re-elect an official who voted in favor of Medicare cuts to nursing homes, and 78% of voters older than 65 feel that nursing home care for seniors would be worse if such cuts to the budget were made. And while the majority of Americans are opposed to this strategy, the most popular approach to health care reform is reportedly taxing those individuals with income exceeding $250,000 annually. The Medicare Part D program was launched in 2006, and by 2008, nearly 90% of beneficiaries had drug coverage that was at least as generous as the standard benefit required of insurers participating in the program, reports profit research organization RAND. Findings indicate that this drug benefit program has since reduced seniors' annual out-of-pocket costs by an average of 16%. In fact, in 9 out of the 10 Part D plans, the average out-of-pocket medication cost to seniors range from about $1,000 to $1,400. And finally, researchers report that the number of prescriptions increased by 7% in the period examined. The subject of health care reform and long-term care is being debated throughout the U.S., and on September 14th, Genworth Financial will present the 4th Annual National Long-Term Care Symposium in Washington, D.C. This forum will discuss challenges family and paid caregivers face and how various policy proposals under consideration in Congress fulfill the needs of millions of Americans. Moderated by Howard Gleckman, Senior Research Associate of the Urban Institute, the event will have 2 panels, the long-term care workforce and policy options for family and paid long-term caregivers. At this event, several members from the Congressional Long-Term Care Caucus and more than 100 long-term care stakeholders and professionals, congressional staffers, family and paid caregivers, industry leaders, and advocates will convene on Capitol Hill for a comprehensive discussion on the intersection of health care reform and long-term care. I'm Sarah Fletcher, and thanks for watching the Spotlight on Long-Term Care. To see more video spotlights on your favorite products and practices, find them on ProducersWeb.com and browse by topic.